So as you all aware, the brain-heart connection is what we're going to be talking tonight about the webinar. We're focusing on exploring neuroscience and how we can regulate the autonomic nervous system. And we're linking the stress and brain waves to the cardiovascular risk that it entails and how we can integrate qEEG and neurofeedback into whole person care. Hippocampus Labs is our company. And we use only FDA cleared technology, and we're leading the advanced qEEG um, uh, pioneering really with leaders from around the world, not just with Dr. Kevin Butterfield, but we have a whole network of neuroscientists that are on our team. So here's a disclaimer. Basically, this is not intended to diagnose, treat, cure, or prevent any medical condition, and you have to work with your medical professional if you want to get that type of advice. But here we're working on non-invasive approaches to help support the whole body holistic care of individuals and helping get them the best results possible from a non-invasive holistic perspective. So here's our leadership team. Dr. Kevin Butterfield, introduce yourself.
Yes, thanks for coming on, guys. I could just give you a little bit of my background. I'm a 91 Palmer West graduate, chiropractor in a very successful private practice. And my dad was a neurosurgeon, so the brains have always fascinated me forever. But I noticed that there was something missing in my practice. Again, I was very successful, very busy, but I had people that would get stuck and not seem to get over the hump. So I started focusing and looking into things I could do in the brain to change that. That's when I came up with the neurofeedback. And I've been doing that for 25 years. And I've helped a lot of kids on the spectrum, adults with depression, anxiety, PTSD, sleep problems. And since I'm a gearhead, I switched over to training IndyCar drivers and NASCAR drivers and other pro athletes to give them the best brains they possibly could have. I was also on a national talk radio, brain injury radio, talking about brain injury problems that people have. And it's really made my practice grow significantly. And I was like the center of excellence in the community. I stood out because they offered from the brain down kind of interventions. So that's my history,
Yeah.
briefly.
Yes, that's briefly.
Yeah,
Which Dr. Kevin's not always brief, but
yeah.
I appreciate that. So myself, Seth Kalin, nutritional therapy practitioner. In 2017, I became board certified as a holistic nutritionist at the National Association of Nutrition Professionals. And when I've worked with Standard Process in the past, many of you have probably heard of that company. Well, really working with integrative and functional medicine, and the best of both worlds is where I'm trying to intersect with neurofeedback and the nutritional care, because supporting the metabolic system with supplementation, lifestyle recommendations, with the best of neurofeedback of supporting directly on the brain and helping to regulate those brain waves so that the brain energy could be supported and the metabolic energy could be supported. So bidirectionally support and get the best of both worlds. Dan Court was one of my largest accounts at Standard Process in New York, nutritional consultant, extremely successful as a nutritional consultant, and has had a lot of success over the years with multiple companies. So our goal is coming together with bringing the best of neurofeedback, the best of nutrition, and the best of business, really to intersect to try to take this across the country to make neurofeedback a standard of care in the modern holistic practices. That's our focus. So this webinar is meant for practitioners that want to get better results. It's bottom line with their patients, really looking at that clinical focus, but to differentiate their practices. Dr. Kevin, he became the center of excellence, really known in his area, and unlock new sustainable revenue streams. And for the topic tonight of cardiovascular care, the challenge is there's a lot of knowledge out there about how to support the cardiovascular system, both in a holistic perspective and also from a medical perspective. But there's a missing link. No matter which way you look at it, there's really not many or any individuals focusing on cardiovascular care and reducing the risk by regulating the brain. And that's really what we're focusing on tonight is how to regulate the brain. When you regulate the brain, you can regulate the heart. And why Hippocampus Labs? With our company, with Dr. Kevin and our neuro specialists around the world, decades of clinical neurofeedback experience, have reviewed thousands of qEEG brain maps. We really put safety first. expert design protocols. There's not any templated automated protocols that our patients and the partners that we support get. They're really customized and focused on the individual data that we get from every single brain map. And that's really the most important part. Ongoing clinical support when you get stuck or need that support on an ongoing basis, daily basis. We're here for you, and we're trusted by professional athletes, race car drivers, and elite performers, and really focus on clinical stewardship and reducing that risk. Not just equipment. It's not just about equipment. We want to be your true partner for integrating brain-based care to make that the modern new way to actually practice with whatever type of practice you have. So if you've just joined us, if you wouldn't mind just looking down for the chat, just type in where you're from around the country and what type of practitioner you are, so that way we can know really where you're coming from. And also make sure you find the Q&A button. We're going to be taking questions and answers throughout this, and if we don't get to your question until the end, we want to make sure that we go through that there. So just put your questions in there when you get a chance, if you have them. So with the Hippocampus Labs, we have a turnkey neurofeedback program. It's a complete system where you get all of the business and clinical support that you need to be operationally successful from day one. We have the operational guidance, all of the SOPs, expert back protocols, on individuals, that we actually have somebody reviewing that information, and we go further and do more research to make sure you have customized care, where you can focus on patient care. And we work on those brain maps to help with making the clinical decision making and making sure that the operations with the techs that are maybe running this in your office are supported with the processes that they need to make sure that they integrate with your system. Strong outcomes, both clinically and from a revenue business perspective. We have one of our partner clinics that within 10 days, we're able to collect over $100,000, which was extremely successful. And we want to help build this into offices to make it sustainable for the long term, so that this is a way that you practice moving forward.
Yeah, and a little bit back on that slide, if I can just interject here for a second.
Sure.
What sets us apart from everybody else, because there's other machines out there, neurofeedback gadgets. Some of them are not FDA approved, some of them don't have the right amount of amplifiers in their machines. And they just pretty much give you the machine, pat you on the back, and say, good luck. We market you inside and outside, and we hold your hand there to get you up and going as good, the quickest amount possible. You don't need to get more office space, and you don't need to hire more staff. So this is pretty much a turnkey solution for anyone interested in doing this, but we'll get to that later. Yeah, neurofeedback itself has been around since the 50s. It's nothing new, but the technology today is you can actually zero in and target specific networks of the brain, specific areas and frequencies of the brain that are struggling. You can see that all. If you do a brain map, that's your that tells you everywhere where the brain is working great, where it struggles, and where to focus on changing that. This is like operant conditioning, like Pavlov's dog, ring the bell, hear the noise, eat food kind of thing. There's no electricity going in your brain. It's just monitoring what your brain is doing and changing the brain waves to make you struggle less. Okay. And this does, the whole process of doing the brain maps and doing the brain training, it could take 30 sessions in your office to get the brain where it wants to be. And once you get it back to that point, it tends to want to stay there. Um, in this, well, we see these patients every day. There's patients who struggle, they're in their 40s and 50s, neck tension, blood pressure creeping up, anxiety. I mean, this is a fast-paced world we got out there. High stress, watch the news. I mean, you should turn the news off so you can not have as much stress. But we can see all these things having a cognitive effect on the brain. We can see how the brain is actually going downhill with all these other problems. I mean, if you're stuck in fight or flight, that's going to lead to a lot of depression, anxiety, increased blood pressure, increased cardiovascular problems. But usually it's the patients that tend to get to a certain point and then they don't get any better. That's what neurofeedback is definitely going to help. But most of your patients should fall in this category. You adjust them, their sleep improves, or whatever you do, modality you do in your office, you should get them feeling better. That means their cortical regulations are intact, and their nervous system is flexible and not stuck in the fight or flight mode. And if you keep anything stuck in fight or flight mode long enough, it automatically turns into PTSD. And it just does. I mean, I'll show you what that looks like as we get down in the slides. Yeah, I mean, these are the patients that they're stuck. They're stuck in the fight or flight. Even if you do have your blood pressure, your heart rate managed with medical care, but you're still stuck in fight or flight, you're still stuck. And you can unstick that, which we'll go over down as we get farther into this when we do our case study.
So why neurofeedback matters? Really, it's to help with, as we're talking about today, it's really the most upstream brain-based regulation that is going to control. It governs the entire body, right? So we're focusing on tonight for how neurofeedback can help stabilize blood pressure, reduce chronic stress, help with the sleep architecture so that way people can sleep better. There's all kinds of sleep devices out there and sleep pills that people are addicted to, or whether they're natural or pharmaceutical. And we help with easing the muscular hypervigilance, trying to mitigate and to reduce both the pain mechanism and also to relax that tension that's stuck in the body. So we can increase retention and enhance therapy. So it's not just an add-on, it's many times just a missing regulatory piece that helps fit in with everything. So stress physiology, it's real. We can measure it. It's very significant and it responds very well to neurofeedback training. The Tor Corget central autonomic networks that we're focusing on that govern the cardiovascular system, neurofeedback addresses that. It addresses the root mechanism of stress-related dysfunction. And this is integrative. It's not an alternative. It's not something that you want to just switch to. We've had some practitioners that we've been talking to that wanted to get out of the type of modality they were working in and they wanted to just switch to this. And that's not what we're trying to encourage. We're trying to encourage adding this on to get even better benefits. One plus one is equal to three. With neurofeedback, you're going to get exponential results. The sum is greater than, equal than its parts. So the whole person, it's the true cardiovascular wellness requires a brain-body integration to help both the psychological and physiological states. So this is how we're looking at, as far as dysregulated brain waves and how they correlate directly with consequences in the body. There's very measurable, states that we can see in the brain waves, dysregulated with excess high beta activity that's just indicated of hypervigilance, anxiety, increased cortical noise, and reduced alpha and mid-range rhythms. So that's the more of like poor emotional regulation, impaired stress and recovery, and the neural timing is very important. It helps to lead to less efficient signaling. The consequences in the body is basically, that persistent threat that's happening that we mentioned as far as fight or flight, that's going to lead to PTSD, as Dr. Kevin mentioned. An elevated autonomic drive is we want to make sure that we kind of calm that down to help support somebody not be in a threatening environment all the time in a state of flight or flight. But the cardiovascular system basically is going to be in that constant state of readiness and not able to recover. So qEEG, that's quantitative EEG, is a window into neurocardiac regulation because it provides an objective measurement that you can focus on and you can change and you can measure it, you can change it. And that drives the autonomic and cardiovascular function. So that imbalance you can reflect it and see it in low HRV. You can see it with patients with hypertension and arrhythmias. And it's really all many times it can be linked to chronic stress and an imbalance in those brain waves. So the HRV reflects that downstream effects on the heart, and qEEG, like we're focusing on, is the upstream, the most upstream that you can go. And that long-term state of sympathetic drive and those brain waves being out of balance is going to be, you're not necessarily going to have cardiovascular symptoms right away, especially depending on how early you catch it. But that chronic stress that you're not able to adapt to, that you're not able to handle, that those patterns is going to increase the strain on the heart and it's going to increase the likelihood that you're going to develop some type of cardiovascular problems in the future. So why this matters? Cardiovascular disease still remains the leading cause of mortality in the United States, and many of the contributing factors Even though people say, you have to relax, you have to reduce stress, but they don't, there's not really not many people adapt and pull this type of therapy into their office to actually support that brain heart dynamic of actually being able to modify the relevant pathway of the brain to the heart and being able to reduce that stress. Because if you don't address the root cause of the autonomic imbalance, then we're not intervening early enough. And most people are focusing on inflammation, toxicity, all of those methylation, all of those things are extremely important, and they make very significant changes. But if we don't ever address the brain, then we're still going to have that chronic stress that's going to long term impact the cardiovascular system negatively. So here's just a quick study. At the end on the last slide, we have 24 different research studies that we use to kind of pull all this information together. But this is just one, just snapshotting just as far as a stress analysis, how they used heart rate variability and EEG to monitor cardiovascular risk factors, and just it showed that EEG is a valid technique to actually measure and change some of these cardiovascular risk factors as far as stress goes. So it's research-driven integration. Fundamentally, we're focusing on the psychological stress because it's not just the mind, it affects the body and it affects the heart. So we're trying to calm down that fight or flight state and relax the body, allow the individual to not remove stress completely because you can't remove stress, it's natural, but we're providing the brain the ability to adapt to stress. And if there is a hyper stressed situation, with neurofeedback, the individual is able to get back into that calm state much faster because we've regulated and trained those brain waves to stay where they're supposed to go. So if the sustained imbalances forces the heart to function under constant physiological loads, it's leading to strain. So if the brain is stuck in survival mode, the heart inevitably becomes a downstream casualty and is getting that impact and strain on the heart and the whole system. So our therapeutic rationale as far as supporting this is because the brain and heart are bidirectional, it's with the autonomic nervous system, the HPA axis, and the baroreflex system. Tonight, we're going to focus on the autonomic nervous system and the baroreflex system, but there's simultaneous signals that are going back and forth, like the baroreceptor input, that influence mood, cognitive function, and emotional regulation. So that relationship's both it creates a vulnerability, but also creates a way that we can actually interject and provide some support and relief for these individuals. And it's the same nervous system that many of you are working with on a regular basis. This is just providing a passive therapy to help regulate brain waves to calm down the system to allow that better communication to occur bidirectionally throughout the entire system. So the heart brain feedback loop, that's the baroreflex system. It's crucial to remain in a balance, in a homeostatic fashion to allow the proper communication to go back and forth unhindered. So the baroreflex system is a rapid feedback system. This is on a beat-to-beat basis. It happens in milliseconds. It's communicating up to the brain, to let us know how blood pressure is, how the heart rate is, and the vascular tone. The receptors, they're located in the carotid sinus and the aortic arch. They are, communicating through the vagus nerve specifically, mostly. And every time that there's a increase in heart rate, the receptors stretch, and the carotid sinus and the aortic arch, detecting that mechanical arterial walls and each heartbeat. It's providing it's a sensor that's then communicating through the vagus nerve up to the brainstem, and it's providing that constant input every single beat. So it's just like a constant reminder to the brain, and it's constantly regulating and trying to regulate the heart. If it's in a constant fight or flight system, then over time it's going to be less responsive and it's not going to work as effectively. So the brainstem integration at the core of the baroreflex is a neurocardiac regulation to nucleus tractus solitarius in the brainstem. That's the crucial command center. That's the primary recipient of the afferent signals coming up from the body and from the baroreceptors into the brainstem. That is then, the brain is communicating back to manage and bring down blood pressure when it's appropriate. And I just want to point out that there's also emotional context here for it receives the NTS. input from the higher brain centers. It modulates input based on emotional states. So it's not just, even though stress, changes our emotional states, but there are, individuals that are just in a certain emotional state that's going to change the way that we respond to stress. It's going to change the way that the brain communicates to the heart. And cortical and limbic input, which we're able to have direct impact on with neurofeedback as well, because it's finely tuned by influence of the cortex, conscious thought, and emotions with the limbic system.
Yeah, and that's where upper cervical work can help lower the blood pressure on patients when they get up. I mean, there's been a lot of studies on that as well because you're right around the brainstem.
Yep. So this is just a summary, kind of putting it all together between the baroreflex, the vagus nerve, and how it affects heart rate variability. The closed loop system is very sophisticated. It's the baroreflex system is basically it's measurement to communicate, is the system stable right now, and how do we modify it? And it's happening so quickly. But that is going through the vagus nerve, where about 80% of the afferent signals are communicated from the baroreceptors up to the brainstem, where the command center and the channel is communicating back with the efferent system to help to calm the heart when it's overstressed or when it's such a high heart rate. And it's the fastest way to kind of calm the system overall. And this is kind of a depiction of how they work together. It's again on a beat to beat regulatory loop where it's reflected dynamically in the heart rate variability if that is measured. But the heartbeat changes, the baroreceptors sense and stretch. Then those signals are sent up to the vagus nerve through the NTS, and the brainstem processes, adjusts, and modulates the heartbeat in an ongoing loop. But if there's stress in that system, it's going to break, where we have another depiction to kind of show you that. This is respiratory sinus arrhythmia, the bridge. This is another thing where individuals, when they say, just breathe, take your time, relax, take deep breaths. It's a physiological response that is occurring, that when you take an inhalation, your heart rate increases. But if you take that long exhale, when you have an extended exhale, it helps to decrease the heart rate. And that rhythmic response helps to balance. It's meant to, and it does, unless it's in somebody's in a very dysfunctional state or they're not able to get out of that stress state. The heart rate will be able to come into balance, momentarily anyway. But so slow breathing increases HRV, and it helps with strengthening the baroreflex sensitivity. And together, we always want to put these things together. Breathing properly is another way what we can impact the cardiovascular system and also help to put us into a more calm state in our brain. So this is something I found online the other day, just as doing research for this presentation, and I thought it was very relevant, where Dr. Hyman was talking about putting your hand over your heart and taking 5 deep breaths. Helps to connect with the parasympathetic system and release oxytocin. Oxytocin, as we know, is a neuropeptide produced in the hypothalamus and released peripherally. And there's a lot of data now showing also that the oxytocin influences brain electrical activity as measured by EEG, and increases resting alpha activity in frontal regions linked to emotional regulation and stress reduction. So again, neurofeedback by itself is amazing, but when you combine it with other modalities and other techniques and other lifestyle changes, really it's that exponential support and exponential response and results that you do get. This is just talking about the sensitivity. So it's the gain control. This is how the system gains control with the baroreflex sensitivity. If you have high sensitivity for the baroreflex system, it's optimal adaptation. So that means that there's a strong vagal response, an efficient parasympathetic braking. There's the heart rate variabilities indicating, it's flexible and it's high. Enhance emotional regulation, stress recovery, and sign of resilience and adaptive nervous system. So there's, a lot of individuals that are in this, but many of your patients are going to be on that compromised, low sensitivity of the baroreflex system, where you have weak vagal influence, blunted heart rate adjustments because it's not responding properly, low HRV, autonomic imbalances. People are in constant state of vigilance, poor stress recovery, and this is very much correlated with PTSD, anxiety, and hypertension. So this understanding the sensitivity of the baroreflex system gives us the ability to tune the neurocardiac system, and it's a critical metric for gauging individuals' capacity to maintain physiological balance and recover from stress. So we're really with neurofeedback able to make adjustments on and help with the sensitivity of the baroreflex system. So trauma, stress, and dysregulation, this is, where things break. We've kind of talked about this where chronic stress, trauma, the baroreceptors are less responsive. We're survival mode. The brainstem is prioritizing threats. The vagal tones are suppressed, sympathetic tone dominates, and HRV drops. And the heart loses flexibility and nervous system loses trust. So it's not just a psychological thing, it's a mechanical and neurophysiological breakdown of the system where the stress and the trauma that's occurring in the brain is physically manifesting in the body, and it's affecting the heart rate, it's affecting the cardiovascular system, it's putting under undue and unneeded stress. So most interventions, they act downstream. There's a lot of access points that we can work with to support the cardiovascular system and cardiovascular health. Common therapeutic tools, breathing exercises I talked about, postural changes, HRV biofeedback. There's a vagus nerve stimulation, lifestyle modifications, and that lifestyle modifications and all of these, they have very meaningful impacts, and they do get amazing results when people are consistent and they are comprehensive and they stick with it, especially the lifestyle modifications, as most of you probably are aware. It's one of those difficult things for people that are not used to those changes, whether it be supplemental recommendations, it'd be detoxification, it'd be exercise on a regular basis. It could, mean different sleep patterns. There's a lot of different things and habits that they may not be able to incorporate yet. And with neurofeedback, we can actually impact the energy that individuals have to be able to actually follow through with those lifestyle recommendations and modifications that you may provide them and programs that you provide them. Because there's not, for many patients that are struggling with these types of conditions, they don't have enough brain energy. They come home at the end of the day, whether they, stress of life and kids and society and work and everything, they come home and they may grab a bottle of wine instead of, a cup of tea or something like that. They may not go to the gym. They may choose, like, I had such a stressful day, I'm going to do this over something that's good for me because it's the easier choice. And they just have not been able to commit to that. So they don't have the brain energy, the motivation. Then our recommendation is to use neurofeedback to help increase that energy in the brain, help provide that motivation, help calm that stress down so they're able to make the right choices. So the more choices they're able to make because they have that brain energy, they have that focus, they have that motivation, then the more likely they're going to be compliant with and consistent with the lifestyle modifications that they need. So it's bi-directional. So we're supporting the brain energy, and lifestyle modifications is provided the metabolic energy. So together, we're able to actually make real, much more meaningful impact on an individual's life and long-term health and all the things that they're changing, because we need to still make those lifestyle modifications. But their downstream impact, it's state dependent. There's a lot of things, as I mentioned, as kind of explained, there's so many things that impact a lot of those therapeutic tools. The patient has to do them on their own, most of them. And for them to be compliant, it's very difficult long term. And neurofeedback improves baroreflex sensitivity, as we've kind of already discussed. It optimizes the intercommunication between the brain and the heart. It leads to a more robust and responsive system through these key mechanisms, through cortical stability, improving that, reducing threat bias, less limbic overactivation, clearer interpretation of body signals, enhanced brainstem communication. So we have more precise efferent signaling going down to communicate with the brain or in the cardiovascular system. Better timing of the cardiac responses because we're able to reduce that stress and we're able to reduce that over response. We're able to increase the listening, the ability to actually respond when it's appropriate, and reduce oscillation between over and under compensation. So fundamental outcomes in the end are improved blood pressure regulation, reduced heart rate variability suppression, and greater adaptability to stress. That's a huge thing. So neurofeedback helps to rebuild the brain's capacity for optimal neurocardiac self-regulation. Why it fits into the system, rehabilitation. We're focusing on, when just as you go to physical therapy for rehabbing a knee or rehabbing a joint, once you rehab the strength in that, and you're able to get back to exercise, you're able to regain the strength. You're able to have that muscular tone because you've done very specific therapeutic practices to help regain that. Neurofeedback provides central nervous system rehabilitation. I like other interventions, and this is passive. This is something where somebody comes into your office and they're sitting there and they're relaxing and they're getting the therapy and then they leave. So they don't have to do other things other than what we're providing them in the office. They're going to get better results if they do more things outside of the office that are supporting the neurofeedback. But neurofeedback itself, it helps and targets the regulatory mechanisms that govern the brain-heart connection. So the cortical regulation, threat versus signaling, autonomic set points, it directly influences and recalibrates that. So we're able to regain control of the baroreflex system, and it trains and enhances the brain's ability to modulate that and optimize its responsiveness and precision in regulating blood pressure, heart rate, and effectively gaining control of the system. So this has a profound impact. It represents true rehabilitation of the central nervous system, leading to sustained improvements in neurocardiac function and resilience. So clinical and research aligned outcomes. And if you have any questions, please don't hesitate to pop them in. I haven't seen any, but just pop them in there. I'll make sure I get to that at the end with Dr. Kevin. But neurofeedback has consistently demonstrated effects across, all sorts of diverse populations, aligning with robust scientific literature, with PTS literature, cardiology research, autonomic neuroscience, and performance physiology models. We're able to increase HRV and vagal dominance, improve emotional regulation, physiological adaptation. We're increasing the sensitivity of our reflex system, faster stress recovery, less sympathetic overactivation, and reduced hypervigilance. So we're able to just calm the body and provide the appropriate response to stress. And if the stress is not, in our environment at that time, it allows us to be able to relax in that environment as well. It helps it put us into a parasympathetic state. Bottom line is neurofeedback does belong in the modern practice and the modern holistic practice, really. If you're looking to provide uh, therapy, to individuals and you want to add on something, going to the most upstream regulatory center of the entire body, you really don't get better than that. So it teaches the nervous system how to regulate itself, and we're able to improve vagal tone, and everything I've already kind of talked about. We're training the loop. If we're training that brain heart feedback loop, resilience increases. And for many of the cardiovascular patients that you have, or individuals that have stress on a regular basis that do not have cardiovascular symptoms or issues yet, but if they have consistent stress, they're heading to an issue down the line. Because stress,
Yeah, and
go ahead.
I'm sorry. No, I was going to say that on the slide before, I said there's a lot of people in your community that are looking for this kind of service for sure. Um, and this is what will set your office, like it set my office apart from everybody else. I was in a town with five other chiropractors, but I was the busiest one because they offered something else that they were looking for, that they needed. So that's really helped my practice out significantly.
Thank you. So stress, it is a vascular risk factor that is proven. The Interheart study established that psychological stress independently increases the risk of myocardial infarction and stroke, even after controlling for traditional risk factors. Mental stress ischemia. Mental stress testing can induce myocardial ischemia and endothelial dysfunction in susceptible individuals. That was a Mayo Clinic. And blood pressure reactivity during psychological stress is a predictor of developing sustained hypertension years later. It's offering early warning signs. So stress Chronic stress to the cardiovascular system is synonymous to how smoking is to the lungs. It's a persistent, underestimated exposure that steadily increases disease risk long before symptoms ever appear. And most people don't think of this like this. A lot of people are aware of the dangers of smoking, obviously to cancer, but also to, heart disease and other things. But they're not linking stress, chronic stress, because many of us deal with it on a regular basis, linking that to actually the cardiovascular health and not thinking that this stress is actually going to impact the health of my heart. There's a case
Oh
of,
yeah.
yeah.
Oh yeah. Sorry. Yeah. So this was my patient, 47-year-old male construction contractor. He was a football player, had multiple concussions. Um, so he said he came in with, can you help me? Because I cannot sleep more than 2 hours a night. I'm depressed and I can't shut my brain off. And I said, well, is that it? What else you got going on here? He said, well, I have high blood pressure that's maintained with medication. I had a heart attack 2 years ago when they put two stents in there. Um, but he just had a whole bunch of issues. So then after we trained his brain with the neurofeedback, we did a brain map first to see where the problem is. And then we trained him for 30 sessions. And in that 30 sessions, it gave him, he went back to his cardiologist who tapered his medications and then took him off his medications because we stabilized his brain because his brain was stuck in fight or flight really bad. It's okay to go there, but don't live there because then that leads to a lot of problems. And we can show the next slide where I'll show you what we're looking at. Okay, so on the left, I'm just going to go over the top two rows at first. That whole top row should be gray, so should the row below it. And anything from the center where it says alpha to the right, so the upper four circles there, if it's red, yellow, or orange, that means he's stuck in fight or flight, period. Okay, he is. I don't know when it started. I just know he's stuck in there now. And now the bottom 15 circles, that tells us how his brain is communicating with itself. There should not be that many colors or lines there because it's just a mess. It's like your brain shares information from one network to the other, but it has to arrive at the same time. If it doesn't, you showed up to the train station, the train already left an hour ago. So that's what his brain is, a jumbled mess. No wonder he can't sleep. No wonder he's depressed. No wonder he's got cardiac issues. And on the right is the same amount of circles that's after 30 sessions. You can see how much the fire's been put out. And where it's dark blue, it means that the electrical activity is so much decreased, it's not doing what it should be doing function wise. But if you look on the right, we cleaned that one up too. So this was a huge thing for him. He sleeps 8 hours a night now. He still does. He's not depressed. He was having marital issues, addiction problems. He just doing all these things like eating gummy bears or whatever they are, the gummy, the pot stuff, or smoking pot to self-medicate it. Because those in themselves will lower the brainwave frequencies, but not at a specific point, right? It will just do the whole brain globally to lower everything. But you can see there's some things that don't need lowering at all, but they're, you know, collateral damage, I guess you could say. So anyway, I see this a lot in the office with and without cardiac involvement. They might get it later, but like I said, if they're stuck in the fight or flight for so long, a plethora of problems develop over time. So if you can interject and get in there before they become an issue to get the brain map like on the right side here, that's perfect.
So we've mentioned this a couple times as far as the protocols. The protocols with come from a qEEG. It's the brain map. As Dr. Kevin mentioned, he did a brain map first because no two brains are the same. Every patient gets a customized protocol because they're all complex. They have individual EEG patterns. There's no brain that's going to show up the same that you can just show that they have cardiovascular issues. This is what's going to happen. We know that they are dealing with all sorts of other things in the world. So that's why Hippocampus Labs, they remove that burden of that interpretation and the protocol design, and we just make ongoing adjustments as needed throughout the 30 training sessions that we recommend. So our neuroanalysts partner with you and develop that refined, personalized protocol for each patient, and we just focus on that for you, so you don't have to worry about it all. So it supports precise targeting, better patient results, and greater confidence from the first day that you implement this. So how it fits in a holistic practice, that objective assessment, that's like a spinal exam, a first day intake, that you do a much thorough analysis of a patient because that provides you a baseline. If you're doing, talk therapy in the office, you have, a much longer in-depth conversation to kind of get the baseline of what is going on with that patient. So this provides that so that we can provide a roadmap of where we're going to go. So then we integrate complementary with, other things, with whatever the patient is on, whether medication, nutrition, exercise, other approaches that are taken with this. It's just going to make it that much more effective. And the patient starts to become self-regulatory after some training sessions, and they get motivated and they get engaged with it. Their confidence starts to go up, and they start to take better measures and make better choices on their own recommend on their own things, like you have lifestyle recommendations that you may be giving them. So they're actually taking more buy-in to what they actually have to do and owning their own health. So it just does not only focus on cardiovascular health. It also, there's other things that are going to be impacted, like pain management, sleep quality, anxiety reduction, and cardiovascular health. And there's a very long list of things that you can impact with this. So we have a rationale of incorporating this with a very minimum, have people exercise. Movement is very important, along with nutrition. Those things, that triad together at a minimum, is what we're going to focus on for the holistic cardiovascular health. And there's other things that you could be doing as well. But this helps support the brain, the body, the biochemistry for really comprehensive well-being. Supports the vagal tone, vascular function, the biochemistry. We target the cortical regulation, as we've talked about with neurofeedback, integrating physical, nutritional, and neuroregulatory strategies. That helps affect multiple axes to help with the stress cardiovascular loop, to help with increasing that sensitivity and to help the body relax and adapt the way it's supposed to. So the future of cardiovascular care is integrative. We recognize, the profound connection between the brain function and the heart health. So this opens up a new therapeutic pathways for preventing and addressing cardiovascular dysfunction, and it provides a evidence-based tool that empowers patients. Patients are really looking for objective data. I'm sure most of you are aware, they want to see that report, they want to see that data to help drive the clinical recommendations that keeps them compliant enough to get those results. So functional and integrative practitioners with the opportunity to shift toward the whole person cardiovascular care, and incorporating this into the conversation helps provide both the best of your conventional approaches or alternative holistic approaches, along with a very measurable objective data that truly combines the inseparable nature of the mind and body. And also just for functional medicine in general, for the brain body biochemistry. The brain, we're focusing on the EEG neuroregulation, body with movement, chiropractic, acupuncture, energy healing, biochemistry supporting nutrition, supplements, detoxification, and the microbiome. We strengthen the vagal tone and support the brain waves to be able to relax, and also able to stabilize the cardiovascular metrics. So together, this is going to be the future of real functional medicine. I just love this graphic. I've mentioned this
Yes,
every
you
time I'm
do.
practicing. I was going over this with
Yeah,
Dr. Kevin. I just love the way this looks.
yeah.
There are other things that are supportive of the cardiovascular health, but we're going to provide these slides to everyone as well with our follow-up email. We're going to send you the PDF so you can take this and use this as well with your offices. But it does start with the brain. There are other things, obviously, that, it may have started through toxicity and inflammation and other things that an individual with a standard American diet has incorporated to impact their brain. But that has, through the bi-directional relationship, it's impacting the brain. So we are, supportive of the top-down approach, where you may be already recommending a lot of these different types of support products or therapies, but incorporating neurofeedback really helps to complete the circle of of comprehensive cardiovascular care. So to implement this, the bottom line is you have to screen patients. Screen patients, try to find which ones are the ideal candidates. Anyone with chronic stress, any hypertension, anxiety disorders, fatigue syndromes, or other stress-related pain conditions. Assess them with a qEEG. Everyone should get a brain map. There's an importance of brain map document that we also have that really it shows how everyone should be getting a qEEG. It's one of those baselines that would be great for even if they're not going to do neurofeedback training right now. It's good to have a baseline. Design protocols done for you. That's really where Hippocampus Labs comes in. You don't have to worry about that at all. We take care of that for you. I'll take that off your plate. And we track it, outcomes. Through this process, there's patient education that's going on to reframe, stress management as cardiovascular support and to help patients understand how they are really impacting their long-term health by managing their stress and managing the conditions that they may be having as far as mental challenges that they're having today. So there's a very big long-term value proposition, to incorporate this with structured care programs, increase patient value, long-term engagement with these patients because you're having better results and there's more things to come into the office. You think about 30 times. Our general recommendation is 30 sessions, and that's 30 sessions within a 3-month period of time, approximately, 2 times a week that they're going to be in your office. That's a lot of times that there's a lot of touch points to whether it's a brand new patient, get to know your staff, get to know you, get to know the other services that you have in the office, because this is pulling them in from a different perspective that you may have not been able to pull them in for before. And just providing that objective data to helps increase retention. We can, craft because the brain affects everything in the body. We're crafting clear clinical narratives to help them understand how this is addressing some of their other main concerns that they may have and increasing referral growth, because there's individuals that are going to be getting results that they were not able to potentially get before, by incorporating neurofeedback. Definitely differentiates you in the market and it's very scalable. So your next step, this is a QR code. I'm also going to pop the link to this in chat as soon as I can move my video out of the way. So this is a scheduling link to book an appointment with me. But there's the QR code if you want to take the QR code. I'm gonna put this in chat. That's a 30-minute meeting to really just go through this individually with you and see how this fits with you for your patients, for you yourself, if you're interested in this for yourself, and for your practice. Because this was not designed, this webinar, just to help you implement neurofeedback. This was designed to educate and inform you. We have a whole implementation strategy and business process that we do to make it extremely effective. Our focus is safe compliance and profitable integration to help you be profitable from day one with that ongoing clinical support. So we provide that, clear roadmap, and we have multiple calls that we'll be going through and really helping you become, that practitioner in your area that, just provides just another service that is next level, that you're going to be getting next level results. And again, as I mentioned, there's a slide here. You'll get all these so you can do more research on your own and see kind of how we put this whole presentation together. But now that we're here at the end, does anybody have any questions? I got a couple that came through. Does anybody have any questions? You can put them into Q&A. I don't even have my Q&A available on my screen as it is right now. Let me look. Q&A. So Dr. Kevin,
Yes.
how often do you see cardiovascular symptoms, that persist, with even if they're well managed? How do you currently explain that to patients if you're working with
Well,
cardiovascular
yeah,
conditions?
I mean, I didn't diagnose a cardiovascular problem. I mean, that's not within my scope. And I didn't put them on the medication. I just show them well, you're in fight or flight. You have the depression. You have the anxiety. That causes your heart to get into a fight or flight scenario that at a second's notice, you're gone. You're in that high, uh, sympathetic overdrive. And if we can lower that overdrive with the neurofeedback, of course, then the blood pressure goes down, the pulse goes down, and they can do whatever they want with their medication with their cardiologist. So a lot of that you can trace that back to the brain. Why are you in fight or flight all the time? It's because your brain waves are not functioning the way they should be.
Very cool. Um, Next question was how long does each session last? It's 20 minutes, 20 to 30 minutes. I mean, it's approximately, right?
Yes. 20, 30 minutes, they sit in a comfortable chair with the sensors on their head and headphones on, and they listen to certain beeps at certain times, specific times, to get the brain back regulated where the brainwaves have to go, have to be. We could talk for hours to figure out what got your brainwaves so jumbled. Could be a concussion. It could be leaky gut, food's not food anymore. It could be a whole bunch of different things to figure that out. But that's not our job, I guess, to figure that out. It's to see where they are today and change it for tomorrow, pretty much.
Very good. Just one more. So actually another one. So what's the minimum number of sessions?
Well, they say 30 to 40 sessions about how much time you need to change the way the brain, so it functions normally or above normal. It takes about that long. And once it gets to that point, that's pretty much how long the brain wants to stay there. It doesn't want to fall back out. Of course, unless you get a concussion again or something like that, then you got to start all over. Not in depth though.
How far back does mapping record the stress response?
We do, it doesn't give us okay. So if you've had a concussion, there's concussion reports that we do. It doesn't tell us how many they've had or when they happened. Just like that contractor that came in, he's in fight or flight at that moment. But I don't know when it started. There's no way to tell that.
All right, cool. Thank you. And what are some common mistakes like practices that want to, have talked about implementing and launching neurofeedback? But any mistakes that they have, like is generally that they should look out for?
Well, I mean, the ones that I've seen implemented, um, wherever they buy their machines or whatever, that's all they do is they just buy the machine and just they don't get any support, any marketing help, any training or anything. It just so it collects dust in a closet because they don't use it the right way they should. And I've also had people ask me that, hey, is this under my scope of practice? And the answer is yes, because you're not diagnosing anything or you're not um, treating any mental health conditions or cardiac condition. You're doing peak performance brain training. So it slides right in to add to your whatever else you do. It's a perfect fit.
Very good. Thank you. So if there's not any other questions, then I think we'll wrap this up. But just wanted to point out again that since you registered for tonight, we are going to have these ongoing webinars monthly. The next one is March 11th at 7 p.m. You will automatically be getting that invitation with the Zoom link, and you'll also be getting the recording from tonight and also the PDF version of the presentation. So take a look at the website that has all of these, so you can take a look at what the upcoming topics are. Again, you won't have to reserve your spot again, but we'll include you in these recommend and follow-ups. And if you have any questions between now and then, please don't hesitate to reach out. You have the email that was sent to you, and you can also schedule an appointment, at that QR code or at the link that's provided in the chat. And we will be talking with you soon. Thank you all for joining. I appreciate it.
But thank you,
All right.
everybody.
Yeah, thanks everybody.
All
Thanks,
right, bye bye.
Kevin. Take care. Bye-bye.